Hi there, and welcome to Hack the Cycle. I'm your host, Nadya Okamoto, co-founder of August, the lifestyle period brand. Today we're going to be talking about a topic that affects millions of Americans, breast cancer. As a 25-year-old, I'm curious what to know both for my current and my future self. And so I'm gonna go find and talk to Dr. Cate to get some answers to my questions. Let's go. Hi, Dr. Cate.
Hi, Nadya.
I'm so excited to meet this thing. This is a mammogram machine.
You got it.
So how does this work? The boobs go here?
One breast goes in at a time. Here they have gowns, so they try to keep the other side covered to give you some privacy. So they'll lift up your breast so that the whole breast gets in here. And then this slowly compresses downward. And then they take some pictures.
And then it sounds like this turns.
The machine rotates. And then for the second set of pictures, it takes a bunch of pictures over an arc, which is the newer form of mammography. The machine is turning, but your breast is being compressed the whole time. So it's not like twisting your breast.
I was wondering if it was like clenched.
Sounds horrible.
Okay.
It's not that bad. It's usually about like 30 to 45 seconds per view. It's really quick.
And the technician is in the room with you?
Yes, exactly. And they can always release you from compression if for whatever reason you're uncomfortable.
So this is X-ray. That's how it works?
Correct.
Which is different from an MRI?
Different from an MRI, which is magnetic energy, and that you're usually in a tube.
How far away am I from needing to regularly get a mammogram?
Usually we start mammography at 40 for average risk patients. If you have extensive family history, you need to start earlier. And most likely you don't need a mammogram before age 30.
I have so many more questions about this and breast cancer, and I would love to chat more.
Let's do it. Let's head down the hallway.
Okay, perfect.
Nadia, why don't you have a seat up here?
Great. I'm so excited to chat. I have many questions. So let's start from the basics. What is breast cancer?
So breast cancer starts in the breast, and basically any cancer is abnormal growth of cells.
Like what cells are we talking about for someone who does not come from a pre-med background?
So there's different types of components of the breast. So there's ducts and lobules, and so there's two main different types of breast cancers.
And what are some of the symptoms of someone who has breast cancer?
So breast cancer can have a bunch of different symptoms. People can notice that all of a sudden one nipple goes in, they can have blood from the nipple, the skin of the breast can start to look like the skin of an orange, or they can feel a lump. Most breast cancers start in the breast and then they spread to the lymph nodes underneath the armpit on the same side. And from there, the lymph nodes are the gatekeepers to the rest of the body, and then breast cancer can spread throughout the body.
And what age is that when you start to recommend the annual mammographies?
Usually we start mammography around 30 for people that have a lot of relatives in their 40s with breast cancer. Average risk women start mammography at 40.
Well, so one of the things that I was wondering as like an anxious hypochondriac myself, are there things that we can do to prevent breast cancer?
So certain things are non-modifiable, such as genetics and having a breast cancer gene mutation, or family history. Those things we cannot modify. Things that you can modify are things like body mass index. So we know that patients that have a BMI greater than 25 do have an increased risk of certain cancers. And then people that drink a lot of alcohol do have an increased risk, and it's 5 or more drinks per week.
I'm curious, how many people does breast cancer affect?
It's 1 in 8 in the United States.
How many people under the age of 40 are getting diagnosed with breast cancer?
For women under 40, we see about 7%. Breast cancer is primarily a disease of postmenopausal women, so meaning after menopause, we see more patients getting diagnosed.
Why does having a baby earlier on in your life reduce your chances of having breast cancer?
It has to do with your exposure to estrogen and then various evolutionary changes that take place once you've had a baby. So the breasts typically become less dense.
What are dense breasts?
People often think that it has to do with the way their breasts feel. It's actually the amount of breast tissue that's seen on a mammogram and how it appears. So dense breasts on mammography look white, and cancers also look white.
Thank you so much for sitting down and chatting with me. I definitely feel like I will be back to schedule my own appointment.
Thank you so much.
Thank you.